The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Melanie's hip surgery, Courtney's heart examination, premature baby Chance has trouble breathing, and Sam and Mason's skull reconstruction.
The operation that we do for this condition is considered a major operation.
Five-month-old twins Sam and Mason were born with sagittal synostosis, a premature fusing of the bones in the skull. Without major surgery, Sam and Mason will not only develop misshapen heads, they could face brain damage.
Sam is he's more active, like he's very hard to hold. He's always standing up, always wiggling. Doesn't kind of eat as well. He's busy looking around and he's pushing the bottle out of his mouth. Doesn't always sleep as long. Like if he naps, he's usually the first one to wake up, and it's harder to get to sleep. So I think he's more active.
So therefore, he's more like his mom.
Yeah, and he's more intense.
He's more like me because he's a little more relaxed, sleeps a little more, kind of likes to lie there and eat and sleep, and kind of like your dad.
Hey everybody.
How are
you guys
you?
doing? Of course. We've got the whole team today. I hope you don't mind. Is that okay?
Oh no, that's fine.
Good.
So Sam, what do you think? Are you ready for the
He
big
has
day?
no idea what's coming. I know
Are
they
you
keep
ready
laughing.
for the big day next week? Are you gonna have fun?
Yeah. Just don't let him spit up on you. You look nice. You don't want to be covered in baby spit up.
So you can see on Sam's head, you can see that he's got a ridge down the middle of the head. The forehead is very strong and very round. There's a little bit of pinching on either side. And the back of the head is kind of cup-shaped, kind of a sort of a round cup shape, and it's narrow from side to side. And Mason's a little bit bigger head and has a very similar type situation. We just have a look. Now you've got a bit of noisy breathing.
Mm-hmm.
Yes.
What's the story there?
He's had it since birth.
Okay. I don't know if you wanted to see the x-rays. I'd be happy to show them to
I
you.
wouldn't mind seeing
Yeah.
that.
All right,
Yeah, I'd like to
come
see
on
what
this
it
way.
looks like. Okay.
So this is Mason's CAT scan, and you can see that on the back of the head it's very prominent, very round. The front is very prominent. The angle between the nose and the forehead is a little bit acute.
Yeah.
And when you look at from above, you can see that the skull is narrow.
Yeah.
Very classic. Okay.
Yeah.
Sam's looks very similar, and maybe a little less prominent back here.
Yeah, because when I look at his head from the side, I never think the back looks as bad.
But again, you can see that there's a suture here. There's sort of a ridge all the way that runs down here. Okay.
Yeah, wow.
So this is what we do. This is that young girl that you just saw in the waiting area. You can see here that we've taken out a strip of bone along there, and we've cut it and replaced it from here to there. We've used that to hold everything out.
Oh, so it's quite a significant cut. It's not just a thin little
Small
cut down
cut
the middle. You take a big chunk out.
That's
Okay, so I need to tell you some scary things now. The operation that we do for this condition is considered a major operation. The biggest risk we worry about is bleeding, as you just talked about, because little children like this can't tolerate much in the way of blood loss, and so we have to have blood available. There is a potential for brain injury anytime we operate on a child. And there is also a potential for catastrophic events, which, touch wood, we've never had at this institution. But it's such as if you cross the road every day, you don't think about something bad happening to you, but somewhere in the world somebody gets badly injured just by simply crossing the roads.
Sam and Mason will return for surgery in 4 days. "16-year-old Melanie was born with a malformed hip that continues to deteriorate as she grows.
Come on down here to the bathroom.
Her left leg has become longer than her right, and physical activity is painful.
I do like skiing and swimming and tennis and badminton, and I guess if I'm like doing it for a long period of time, it starts to get sore. And
it got so sore that we went to see Dr. Wedge, and he suggested that if nothing was done before she was 25, she would need a complete hip replacement.
Today, Melanie will undergo surgery to reposition her joint, in the hope she can avoid a hip replacement for many years.
You okay?
yeah.
How are you, man? Nice to see you. How are you? Do you have any questions since we last met?
I don't think so, not now.
So the incision is on the outside.
The incision is on the outside, right down the side of the upper side part of the thigh. We make a cut in the bone and take out a piece, change the direction of the ball and socket at the upper end of the thigh bone so that it's pointing into the socket. Right now it's coming out of the socket.
So you're taking some of the bone out?
Well, we have to take a little piece out right here to correct this deformity. We take a little piece out like this so that can come down like that, you see? Okay. Any other questions?
No.
I'll speak to you as soon as we're finished then. And,
That'll be great.
Parents post-operative waiting area.
Thanks very much.
We'll see you in a few minutes.
Okay.
Getting two children ready for surgery on the same day has been a challenge for Sam and Mason's parents.
This is what's tough about having two. I think Sam will be in recovery and we'll probably be heading in to see him not too long after Mason's been taken in. So I think that's going to be hard. Like there's going to be no sort of time. Although maybe that's good. Maybe it's good that there's no time to sit and think about it.
Yeah. Anybody? We're gonna get you for the stress. Yeah, we're gonna get you later in life. Put side by side.
Sam will go to the operating room first and has a final checkup to ensure he is healthy.
Couldn't do that. Which way do you want it? Like
That's fine.
What did you get to say?
Yeah.
Yeah.
You're going to tell us all about it. Show me your tongue. Yeah. Yes, you told me all about it. Yeah. You're doing so well. What will happen is at 7:30 we'll take Sam down. You'll see Dr. Forrest, you'll see the anaesthetist, and then he'll go in. And then when you've settled him, you can just come up with Mason and I'll do the same thing with your other son.
Needs to be put down.
Sam will be taken for his surgery in just a few minutes.
Where are you going?
Other stuff is still on.
Meanwhile, the OR team is ready for Melanie.
Take her.
I'll take her right by her. Promise.
It's obvious, I think it does count. It's nighttime. I do my running up for night here today.
It's funny to see her walking away.
You see on the standing film that the left leg is longer than the right, is indicated by the higher hemipelvis. And our objective here today is to reduce that to a normal angle and thereby also equalize your leg lengths.
An opening is made in Melanie's thigh to expose her hip.
Okay, just make sure there's nothing bleeding there. And it's important to get everything set because when we cut the bone, then the bleeding cannot be so easily controlled. We'll have the saw next now, please.
The team begins to cut the piece of bone from Melanie's hip so it can be repositioned. Sam is taken to the operating room for his surgery.
Are you ready? Are you ready? Ready to have a round head. I'll follow you.
And so we're going to do an operation today which is going to reshape the head in a way that will allow for the brain to grow on the inside and push the head into a more normal shape. In some ways, like the petals of a flower, everything sort of opens up and becomes a more round shape.
This is neuro.
The team begins by making an ear-to-ear incision to expose Sam's skull.
2 pickups, please. Ben, why don't we just open this up first? So what we did last time is we just elevate at the scalp flap. And instead of stripping off the periosteum everywhere, we sort of left it on because I think that helps cut down on the blood loss.
Doctors must work carefully to avoid bleeding. Even a small amount of blood loss could be devastating for a baby. The Hospital for Sick Children's Neonatal Acute Care Transport Service arrives at Pickering Hospital, 45 kilometers outside Toronto. 90 minutes ago, a baby boy was born 2 months premature. Baby Chance is having trouble breathing, and the team must ensure he is stable enough to travel to Toronto for more specialized treatment.
My name's Mark, this is Karen.
Hi.
Hi.
I'm Susan Campbell. I'm the physician and the pediatrician. Nice to meet you.
Hi.
How are you doing?
Good.
Good.
This little guy's doing great.
Good. Any CBC sent?
CBC culture diff all sent.
Great.
Baby's had AMP and GENT.
Has he ever had a chest x-ray done?
No, in fact, they're just here now. I just wanted to wait until the lines were
That's
in.
great. So you know what? I'm going to switch the tube. I'm going to give him a 3 because we have to give him surfactant. On those parameters, he's meeting criteria for surfactant.
The team will begin by replacing the baby's breathing tube and administering medication to encourage his lungs to function.
You're going to fight me all the way, aren't you?
Oh, he's a fighter.
He keeps swatting at us.
Yeah.
Okay.
All right, I think so, yep.
So I'm ready when you are.
Okay, I just need a bit of elbow room.
Sure.
Okay, I can't grab this tube, it's behind your
Yeah.
tube. Push, 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 stop.
Push. Okay, I'll let you have that. I'm on, and he's
Oh, you're wild.
nice and active. Ready when you are.
Now that the new tube is in place, Chance can be given the medication to help him breathe. Baby Chance will be closely monitored until he is stable enough to be moved. Melanie's parents wait for news from the operating room. Doctors continue to cut the wedge of bone from her hip.
Let's have a bone cutter, please, or so rongeur, please. There we are. And this is the piece of bone. And you see it's up a little bit into the neck through the trochanter. Okay. Let's realign the rotation. See, there's the appropriate rotation of the leg, eh? Yep. So we want to turn it maybe like that. Now let's have the plate, please. Okay, screws, 32 first. Good, that's going to give us about 12 degrees of offset now, which is what we want. Plate with 3 screws in place now. It's a good tight closure there.
The team can now close Melanie's thigh, and her surgery will be complete.
Everything's fine?
Everything okay?
Yeah, it's perfect.
A little ahead of schedule.
It took less than an hour to do the procedure. And we were able to get it into the desired position. By the way the x-rays looked at the end of the procedure, I think you can expect that her hip will function fine for many years to come. Yeah, I would expect that it would be into her 40s or 50s.
Oh, really?
Yeah.
Okay.
Great. Okay, that's very
And she won't feel
encouraging.
the pain that she had before?
She should not feel the pain.
Okay, great.
Okay.
Good, thanks very much.
I'll be up to see you tomorrow and later today if there are any problems.
It'll be fine. We'll go see her.
Sam's parents have only begun their long day of waiting for news from the OR.
So I'm gonna be tired by the end of all of this.
Yeah. Dr. Forrest said it would be a long day, and he's absolutely right.
The neurosurgery team has removed bone from Sam's skull.
Okay, can I get the bone back, please?
Now the plastics team can begin to rebuild it.
Okay, so this is the piece of bone that's been taken out along the length of the sagittal suture. And just to provide some protection, we'll just take this out and we'll lay it in like that and fix it with some sutures. And that will allow for the expansion to be maintained, but also allow some protection for the large soft spots on the head. Let's put a couple of drill holes here and here, and there and there.
Sam's skull will be completely reconstructed, piece by piece. Chance is now ready to travel to the hospital for sick children. First, he is taken to see his mother, who must recover in hospital for several days.
Hi, Melissa.
Up down.
Take his hand. We've actually seatbelted that hand down because he's so active.
He's just really strong. Big, strong guy.
So that's 3 pounds. Yeah, he needs to be about 5 pounds before he comes home. And feeding through the night, and you're able to look after him. So there's some weeks to go through to get him ready to do that.
How long before I get to hold him?
If you come down and he's fairly stable, the nurses will help you. They'll be right with you and you can hold him. If you can look past all the wires and lines and focus on him, it's not so scary then. We're going to take good care of him, and somebody is with him all the time. It's safe to travel with him. Okay.
3.
Chance will be cared for by the neonatal intensive care team at the Hospital for Sick Children until he is well enough to be transferred to a hospital closer to his home in Oshawa. Sam has been in surgery for 3.5 hours. His skull reconstruction is nearing completion.
You can see this is where the skin was when we started, when we separated, made the incision. And very easily we can overlap the skin by at least 1/2 inch. And what this reflects is the amount of shortening that's gone in the skull and how much widening has occurred. So we need to put a head dressing on at the end of this, guys.
Okay, that's great.
While Sam is closed, Mason is prepared for his surgery.
I can't wait to see what they look like after.
It's coming again.
You getting upset again?
Again, yeah. I don't know why.
Well, it's pretty major.
Everything's gone as scheduled, so that's good, right?
Yep. It's going very well, I would
Hold
say.
on a chair to stand up.
You should just sit.
Yeah.
One down, one to go.
I'll be better on this one. I'll be better.
Yeah.
I'll be better, Mason. You've been a trooper, I'll be a trooper.
Yeah.
Okay? Deal?
You're doing very well.
Is that a deal?
The twins' parents wait for an update on Sam while trying to calm Mason for surgery.
Oh, I know you're hot.
It went well.
Good.
Well,
Yeah.
he's extubated.
Good.
He's in the recovery.
Oh, is he freaking out at all?
No,
Is
he's
he
fine.
okay?
He's had a little bit of morphine.
Good. Before.
No, is he the guy who coughs?
Yes.
Yes.
Right.
He's the
Quite a cougher. He's really like, I guess it was his
That is him.
nasal.
That's
Yeah.
not today or yesterday. That is him.
Since birth.
Right.
Hey, Mason. Mason. Hi.
But he's never like frankly wheezy.
Well, I can't
That he
tell.
needs meds for. That
No,
he,
no.
It's possible that he may therefore have a few more problems with his breathing afterwards. Who knows?
Yeah.
But
Right. Thanks so much.
Thank you.
Okay. Oh, 10 minutes of bouncing.
Trade off.
Oh, come on, Mason. Here we go. Oh, bounce, bounce, bounce.
Yes, we'll give him a little.
Okay.
We're ready, Mason. Let's go see how many
hot. I don't
animals.
want him.
Is he really warm?
Well, that could be me. I shouldn't say that. Other very
Well,
warm.
it's happy this
And
way.
he likes
so.
to go.
My
Yeah, he
nephew
likes
likes
to
it
be
this way too.
Bye,
Okay.
sweetie.
I'll take good care of him. Nee, doe ze your brother.
You're gonna look so different after.
Ja, okay, let's go see some
Bye,
now.
sweetie.
Oh, look better, yeah?
Yeah. There he goes. You're gonna be okay. Alright. Don't cry, because you're gonna make me cry.
Dr. De Ruyter, our anesthetist, has indicated that his chest sounds a little wheezy. We may find that if we run into some problems with his breathing throughout the surgery, we may have to change our plan just to do it in a safe and effective fashion. Hold still. Knife, please.
Changing the plan could mean sacrificing cosmetic elements of the surgery or discontinuing it altogether if Mason's ability to breathe is in jeopardy.
You'll find every single
Just 3 days after her hip surgery, Melanie is already up on crutches.
To sit down or to the stairs?
I think to sit down because I want to fix your crutches for you first.
Before she can be discharged, Melanie must be able to safely use her crutches on stairs.
Okay, now you want to be really close. Really close. Okay? And push through your hands. Try and put as little weight on that left leg as you can.
Yeah, I'm really not putting my kind
Okay.
on.
That was really, really good, except
Yeah.
you didn't have your whole foot on the step when you came up.
Oh, okay.
Okay? That's when you're gonna fall. How do you feel with that?
It's okay.
It's okay? So you did pretty good with the crutches. Do you feel good about it?
Yeah.
Yeah? You think you could do it at home?
I think so.
Yeah? Do you have a stool at home?
Yeah.
Melanie will return in 2 months for x-rays and a checkup to ensure her hip continues to heal.
Keep it elevated. That's hard. Yeah.
With Mason in surgery, the twins' parents can now see Sam in the recovery room.
There you go. Oh boy. Hi. Hi. Hi, sweetheart. Oh, his head looks big. Totally looks different. Hey? I think he looks really different through here. His head usually goes in there. Unless it's just the swelling. Okay.
And he's getting blood now, is that right?
A little bit, yes. We're checking his, he's oozing a little bit in his drain here.
Totally looks
She said he's bleeding a little bit more.
Stop bleeding, Sam. Yeah, I'm trying to drain more of that out. So we just have to talk to Dr. Forrest about the blood loss, though. Or he'll
Yeah,
talk to us
well,
about that.
he's been in a couple of times just to check and see how much he's oozing.
Sam's bleeding could be caused by a temporary inability to form blood clots. Or it could be a more serious surgical problem that would mean a return trip to the OR. Mason has been in the operating room for 4 hours, slightly longer than Sam.
Things have changed a little bit. Sam's doing fine, but he's bleeding a little more than they would like. So they're monitoring that, and they're having difficulty with his blood clotting. So they're giving him more clotting factors and trying to get that balance just right. And we just got word from the surgical suite that it's not going as well with Mason, that he's having some breathing problems. We'd always wondered if he's always been a bit wheezy, and everyone said it's been above the lungs and high. And the anesthetist just spoke with my wife, with Nadine, and mentioned that they just are going a lot slower.
Surgeons have been able to complete Mason's skull reconstruction, but his breathing tube will not be removed until he is stronger. The twins' parents can now be reunited with both boys in the critical care unit.
Ready? See him?
Ready.
I can't even tell if that's him. Isn't that scary? Hi. Hi. Oh my gosh, this is Sam and Mason. Mason. You haven't seen Mason? No, I was saying like I can't even tell if that's him.
He's got the tube, so you can tell.
Did the doctors talk to you about having to keep the tube in for the next little while?
Yeah.
And ideally, we would like to wake him up and get him, you know, to assess his neurological status, get him awake and opening his eyes.
Yeah.
But his instinct when he does wake up is to just reach for the tube and pull at it. So
He's a fighter.
yeah, so that's why we have these little restraints on his.
So should we check out Sam too? Where's he?
It's right across the room.
Okay. So we can go see what he's doing. Come back, yeah. I'm sure we'll just keep doing this all night. This isn't as fun as Mother Goose program. How good is it? No. He's still got quite a bit of blood, eh?
Yeah.
It's slowed down considerably.
Has it?
It's much better.
He's been bleeding for a while, this guy.
I know, it's amazing. So he's not getting any more blood though, obviously, right?
No, we've held it right now. We're
Okay.
gonna wait for his blood work to come back. He's very puffy and he's breathing a
He
little
might
bit
have a lot
quickly,
of
so
stuff in there.
yeah, we don't want to give him too much fluid. And
Oh, sweet. Poor little thing.
Sam and Mason will remain in the critical care unit until they become more stable.
Peaks on day 2.
3-year-old Courtney was born with a malformed heart and has already had 2 major surgeries.
Good job.
Now that a year has passed, Courtney's heart must be examined from the inside to determine if she requires further repair.
Well, today they're doing a catheterization, which is they enter the bloodstream right with a catheter, which is like a scope, and they fish it through into her heart, and it has a camera on the end, and they can look to see how everything looks.
Hello, Miss Courtney.
No, ouch.
First things first. Courtney, can I have a listen
It's a bracelet
to you?
today.
Should I come over there? You keep holding your blanket? Now listen to your heart. What's it going to say to me? Is it going to say tick-tock, tick-tock? I like you. Now I've got to listen to your back. Can I lift your shirt up here? It's going to be cold. Brr. Oh, you're helping me. Okay, here we go. Your hair's longer than mine. That's not fair. 'Cause I'm bigger. How did that happen?
It's even longer when it's wet.
Does your brother pull it to make it longer?
Yeah.
No.
Yeah.
So they'll
Still on
just,
schedule?
I can call down and see, and they usually just sort of call at the last minute, and then you can just carry her down and just put her in the gown at the last minute. And one of you can go in with her when they put her to sleep.
Okay, so I'll go get the gown. Thank you, Courtney.
Say goodbye to Debbie.
Two days after surgery, Mason is able to breathe on his own, but still needs supplemental oxygen.
Feeling better. His breathing still gets me a little anxious, but my worst day was surgery day, and I'm sort of over.
Sam is no longer bleeding, and his surgical drain can be removed.
Is it? Is it pretty fast?
It's pretty fast, but it might surprise you how long it is.
Oh no.
It might be in there like
Like
to,
all the way around
4 or
the
5
outside.
inches.
Yeah. Someone just yelled down the hall that you're busy.
Thank you, buddy. Here, hold your hand. It's not bad, buddy. Hey?
There we go.
Well, I've seen worse this week. Hey.
I'll see you again.
Yeah. First, we'll go down and get a picture of your head, and then we'll go see your brother.
Sam will now be taken for a CT scan to make sure there is no hidden bleeding in his skull.
I don't know where it is.
If the CT scan reveals any problems, Sam could need immediate surgery. Courtney is taken to the waiting room for a final meeting with her cardiologist.
How you doing?
Hi.
Hi, Kitty Pie.
Say hello.
So you're the star of the show, eh? Well, you know what we're going to take out. Just take the catheterizations we've done before, except this time we're going to look for any narrowings or any abnormal vessels that have formed since the Fontaine operation. Okay, Smiley, I will see you later.
Okay, thanks.
And the best place for you to be is in the surgical waiting room?
Yeah, we'll be there.
And then I'll come and speak with you when we're done.
Okay, great.
Okay,
Thanks. Okay, sweetie.
She's ready.
We are all ready. See you later, Dad.
Hi, Daddy.
Bye, Daddy. Okay, so your wife will be back up in a couple minutes, okay? You can just sit here and wait.
A catheter is inserted into a vein in Courtney's groin, up into her heart.
We're maneuvering the catheter up through the heart into various chambers. Okay.
Dye is injected to allow the team to track her circulation.
Her ventricular function looks excellent. Plane of the,
Doctors will continue to examine every part of Courtney's heart to look for abnormal veins or obstructions. Sam's CT scan shows a blood clot.
It's unfortunate, but I think that you don't want to know.
Why?
Well, his CT scan shows that he's got a collection of blood that's sitting under the left frontal bone, and what it's doing is it's collecting there and it's slightly pushing on the brain. It's not causing any dysfunction or any significant problems right now, but Dr. Dirks is concerned because it is pushing on the brain, and if it was to get bigger, then there might be a problem. So what Dr. Dirks would like to do is to take him back to the operating room sometime in the next few hours. We'll open up the incision, just basically reach in there and just suck out that blood clot. So I think that this blood clot is probably a direct result of the coagulopathy that occurred at the time of the surgery. Okay. But as I said, Dr. Dirks is concerned enough that, and he's the neurosurgeon, he gives his call on this. But you know, it's 2 steps forward, 1 step back sometimes, so.
Okay.
Geez, you never think things are going well, eh?
Things are going too well, buddy.
So, you know,
Sam will be taken into surgery in the next few hours. Courtney's examination has been underway for 2 hours. Doctors have found an abnormal vein.
Push it up. Okay. I guess you better put a little coil in this. It's an abnormal vessel that forms after the surgery. So if some blue blood mixes with the red blood inappropriately, and it's a potential source for particularly when she exercises, that she can become blue, and they can become bigger with time. Okay, now pull it back.
A coil is placed into the vein to permanently close it up.
A little bit more. So that's all closed now. Okay, so now we're done. Everything's fine.
Yeah, that's what I wanted to hear.
Yeah, everything's okay. The pressures are low and there isn't anything to worry about. We did find a abnormal connection from below the diaphragm to her left atrium. We put a little coil in it and closed it off. And we'll see in a year.
Wow.
A year.
I like that.
Yeah.
Sam is taken to the OR to have his blood clot removed.
So we're just looking at the post-operative CT scan on Sam. What's concerning about this is this large white area here, which indicates a blood clot. And the blood clot looks like it's sitting above the brain, but it's pushing on the brain. And if this got bigger, then it would be a significant problem.
He's still well neurologically, but because of the size of it and the local compression of the brain, it's much safer to take it out.
Opening up the incision, so it's going to start bleeding a little bit.
This is all the clot here that's underneath the bone. This didn't happen today, you know?
Didn't even think of going back in as a possibility. Never dawned on me.
Even though we knew it was a possibility.
I guess, but I don't even
Like
really
a
ever remember
remote-
that.
Yeah.
I'm
So-
sure we've been told, but it never
Yeah.
dawned on me that there would be a reason to go back in.
I guess we should then look around and see if we can find anything bleeding. This didn't happen today, you know?
Courtney is examined by cardiology to determine if she is ready for discharge.
That's pretty big.
Okay, so I'm just gonna take a look at you before you go home. Okay?
Gonna take one good look at you and then we can go home and see Tyler, okay?
We're just gonna check your feet here. What? How many toes do you have? 5 and 5. Oh, well that's good. What about up here? Ow. Uh-oh, where is it? Ow. That's good.
Very soon.
No, we're not going home. We're going to Voss home. That's right. We're gonna go to Voss home and pick up Tyler.
Well, you're all set. Your heart sounds A-okay.
And you eat all done?
All done.
Just 6 hours after her heart repair, Courtney can go home.
Let's go. Bye, Dad.
It has been 2 weeks since Chance's premature birth.
Slide him out a little bit so Mom can have a good look at him. There you go.
He no longer needs the specialized care available at the hospital for sick children and can be transferred to a hospital closer to his home in Oshawa.
How are you doing
That's
today?
good.
Good. Ready to go tomorrow to Oshawa?
Yeah.
Great.
And we're pretty happy that he's ready. He's done really well. The tube came out, so he's been breathing on his own for a little while now. He's still got machine there, but it's really just providing some pressure to keep his lungs open, but he's doing all of the breathing on his own.
Yeah.
And I'd expect that in a little while, once he grows a little bit more, he won't even need that pressure supporting. His only medication is the caffeine to help him remember to breathe, because some of the premature babies have trouble remembering to breathe. And he's doing great otherwise. There aren't really any other problems. Are you happy with him?
Oh yeah.
It'd be nice to have him closer to home.
Oh yeah, it's only like a 10-minute walk and
Yeah.
I can see the hospital from my house.
Great. Okay.
Cool.
Great.
Yes.
Well, good luck.
Thank you.
Okay, bye-bye.
Chance will be cared for in Oshawa for several weeks before he can go home with his family. Doctors have successfully removed Sam's blood clot.
Hi.
Hey. I think yay.
We're finished.
Good, okay. So anything unexpected when you went in?
Well, we found a fair amount of blood clot underneath the scalp.
Yeah.
And then also we found the large blood clot just underneath the bone. And the blood clot, it's like jello that's set, so it's quite thick. So I think it's really good that we took it out. It's not something that's going to dissolve quickly, so.
And you thought the brain looked okay underneath it?
Yeah.
Yeah, can you tell just by...
Well, we don't want to open the coverings of the brain, so we just leave it. And
The good news we were expecting, right?
Yeah.
We're hoping.
And the brain looked healthy underneath it on the scan as well, so.
Well, thank
All right.
you, both of you.
Okay, thank you.
For the umpteenth time, you guys are
Okay.
great.
Thanks for the support.
Okay,
Appreciate it.
bye.
Talk to you later.
Okay.
I just feel like I can just collapse.
I know, it's
Don't
like
you?
an emotional roller coaster.
Up, down, down.
I know.
2 days after his blood clot was removed, Sam is assessed by neurosurgery.
Sam looks like he's doing a lot better now. Swelling's come down, and his wound looks like it's now healing well. He's not happy yet, but that's what we expect.
Yeah.
If he wasn't bothered by this, we would really worry. So
Yeah.
that's a good sign that he's still not happy, but he still settles in your arms, and So he looks like he's really come around in the last couple of days, and he's doing well now.
Good. And we
So I
can go
think-
home.
Yeah, I think you can take him home now.
Yay.
Excellent.
What we needed to hear. Hey, Sam? So I guess, do you want to see his brother?
Yeah, let's go.
Hi. Hi.
Lisa looks a few days ahead of Sam. His swelling's a lot better. His wound looks really good.
We get to go home, buddy.
I think that's it. You know what to look out for. Keep a close eye on things, especially their wounds. Measure their temperatures.
So I can do that.
Anyway,
Thank you
thanks,
so
Dr.
much.
Birch.
okay.
Oh,
Call if you have any concerns, okay?
yeah, we definitely will. Appreciate it.
All right.
Glad that's all over.
All right.
Two months after her hip surgery, Melanie returns for a checkup.
How's everything?
It's good.
Let's see you walk there, don't you? How long is your operation now?
2 months.
2 months? Are you limping less
Yeah.
since you stopped? It must have been difficult at first, was it?
Yeah.
Here we are.
So that plate comes straight across the bone? Okay, I didn't...
That's inside the bone and that's outside the bone, and the screws are through the bone.
Okay, and it's all one piece?
It's all one piece, and it looks like this is healing up very nicely. And the orientation of the ball to the socket is looking very good now. Okay, everything looks really good. We'll see you then in 4 months, and call me for any problems.
Yes, I will.
Or if you have any questions.
Okay, thank you.
3 months into her recovery, Melanie continues to get stronger.
Feels good. Feels better. And then it'll slowly get even more better, so we'll have to see.
Now that she has had her surgery, doctors hope she will not need a hip replacement for many years. It has been 6 weeks since Courtney's discharge, and she is back to her old self again.
You want to see the star? Oh, you're easy. You see the star?
Yeah.
Courtney will return to hospital on a yearly basis for a complete examination of her heart.
And the bell.
3 months after surgery, Sam and Mason return for a checkup. They have been wearing molding helmets for the last 8 weeks.
Oh, to you too. He likes to do raspberries now, this guy. Oh, crack.
Hey, Dr. Force can't see that happening. Yeah.
Hello.
How are you guys doing?
Good, how about you?
Good.
Take Mason's helmet off.
I've been feeling, and their heads feel great.
Yeah, Kevin's been diagnosed.
Oh, okay, I'm glad. Okay.
I'm very much an expert now.
Yeah, you can pick up your medical degree on the way out. Okay?
No, he thinks he knows.
Hey. Hi there. Boy, you look good.
I think he looks amazing.
You look really cute.
Mm-hmm.
And let's have a look at you, mister.
Big boy.
Let's have a look at you.
Say hi, Mason.
I don't have a problem with discontinuing the helmets at this point in time if...
Says it's so nonchalant. And it's like,
That's all we've been waiting for the last month.
Yeah, I think things look really good in terms of their head shape. I think you guys have done wonderfully well. And
Thank you. Did you guys hear that?
you guys get to have your Christmas pictures taken without helmets.
Look at
I
that.
know, isn't that good? Thank you so much.
Have a nice Christmas.
Thanks
Thank
for
you very
everything.
much.
Nice Christmas to you
Yeah,
too.
so we'll coordinate the follow-up.
Okay.
But as I said, we're here if there's any concerns.
That's great.
All right.
Thanks, Dr. Forrest.
Thanks.
Take care. It's all over. Yay.
You hear that, buddy? It's all over.
I'm glad you've had it
smoking.
done. Yeah.
Buddy.
Ah, can you do a high five?
Grab her hair.
Can you do it? Yay. You want to give him a hug? Oh.